Hi, I'm Suzanne, and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. I'm going to talk to you today about your post-operative instructions for a breast augmentation or a mastopexy. We're first going to talk about your activity. When you go home today, you're going to rest. And it's important every couple of hours that you wiggle your toes. You don't need to wake up in the middle of the night and get up and walk around, but we do want you during the daytime hours to get up and move and wiggle your toes and keep that blood circulating. If you have TED hose on, you need to keep those on your feet too for about 14 days after your surgery. Also, it's important to remember that you can't do any heavy lifting or bending. There's no sexual activity for 2 weeks after your procedure. And you also need to not drink alcohol or smoke during the next 2 weeks. Let's talk about your position. We talked a little bit about that in your activity, but you do need to sleep elevated for up to 2 weeks. When we talk about elevation, it needs to be a minimum of 2 pillows high. Like I said, you can use a recliner chair, or you can use a couch, or you can even get those neat pillows that kind of sit behind you. But you do need to sleep elevated, and you are going to need help for the first few days getting in and out of bed and going to the restroom. Let's talk about ice packs. Ice packs are something that you can use 20 minutes on, 20 minutes off to the affected area. Something that's really helpful is to use frozen peas. I suggest that you buy a couple bags of frozen peas, and then you can rotate them through the freezer and just apply it to the area that you have had your surgery. Next, let's talk about wound care. You will have tape on the area that you have had surgery. That tape is going to remain on until your first post-operative appointment. If your tape happens to wear off during that time, then you can just apply brown paper tape that we have in the office and reapply that back to the affected area. Let's talk about your garment. When you leave surgery today, you're going to have a bra on, which would be like a sports bra, and you're going to have an ACE wrap wrapped around that entire area. You're going to leave this on for a week after your surgery. However, it is okay to shower 3 days after your surgery, as long as you don't have drains. 3 days after your surgery, you're going to remove the wrap. It's a big ACE wrap that's going to be all around your chest, and then you can take your bra off and take a shower. However, when you do shower, please don't face the shower. Wash from behind, have the shower head back behind you. Try not to get the tapes wet. If those tapes get wet, then you need to use a cool hair dryer to dry those tapes. And then when you're done with your shower, you're going to put your bra back on and re-wrap the ACE wrap. It's important when you wrap with the ACE wrap that a majority of the pressure is in the upper portion of your implants. This is to help relax your implants and keep them down. Typically after surgery, your breast implants want to lift up. That's why we want you to wear the ACE wrap for at least a week after surgery. During your post-operative time, you're going to be taking pain medication. We don't want you driving while you're taking any pain medication, because this does inhibit your ability to make good decisions. We're going to talk about your medications after your breast augmentation. You'll first have an antibiotic, which could be Duracef or Cipro, whatever the doctor prescribed for you, and you're going to start taking that as soon as you come home. Typically, it's only 3 tablets, one that night, one the following morning, and that following night. You're also going to receive some pain medication, which could be Norco or Ultram. It's also very important to take Colace, because the pain medication and general anesthesia can make you constipated. Another very important medication for you to take, even if you're not in pain, is the Flexeril medication. The Flexeril is a muscle spasm, and this helps keep the muscles relaxed during the recovery period. If your muscles tighten up, then your muscles are going to tend to draw the implants up, and you need to take this medication to help keep these muscles relaxed in the implants where they should be. If you are having your implants on top of the muscle, you do not need Flexeril. This is only for the patients that are having implants under the muscle. The rest of the medications that you could be taking would be your Zofran for nausea, which you would take every 12 hours and it dissolves under your tongue. Another one could be if you tend to have high blood pressure and that's not something that was controlled, or the doctor just wanted you to take that during your surgery period, would be a clonidine patch. And also some of you that have an issue with getting breakouts of herpes around your mouth, they might have you take Fanvir. Your TED hose are something that we recommend that you have during your procedure. You can wear these up to 14 days. However, we do recommend that you start walking the first day after your procedure. If you're walking normally and not laying around a lot, you can take your TED hose off, but if you tend to lay around, we want you to wear these for up to 14 days. Your TED hose help with the circulation in your lower legs. And just another tip for you to remember, if you happen to fly on an airplane or sitting in the car for a long period of time, throw those TED hose on so they get multi-use out of them. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.